There are certain known causes. Again, breast cancer is not like lung cancer. So, lung cancer, smoking is the biggest cause of lung cancer, and smoking by far accounts for 95% of lung cancer and increases the risk of lung cancer by 40 times compared to non-smokers. There is no such huge risk factor of like that in breast cancer, but certain things we know. A lot of breast cancer is estrogen driven. So, women who've had early menarche, so their body started having estrogen exposure, or they started having periods at an early age. So, their body started having estrogen exposure at an early age. Women who've had late menopause. In recent years, you may have heard hormone replacement therapy that has shown, but all of these factors increase the risk by 10%, 20%, 30%, nothing like smoking, which increases by like 40 times. The other things is 1 to 2% of breast cancer we treat may be genetically driven. And it's important to note that despite the publicity from Angelina Jolie, most breast cancer we treat is not hereditary. There, or at least not the BRCA type hereditary breast cancer that is seen in less than 1% of breast cancer, which is generally we would treat. There are obviously families there who seem to have a higher incidence of breast cancer, and there is no known genetic mutation that we as human beings or doctors know of at the moment. Maybe in 5 or 10 years we will know more, but these are some of the things. Then I think excessive alcohol has also been slightly, like very marginally linked to it. Overweight has been marginally linked. Certain rices, I think African American women are slightly higher chance. So, these are just some of the risk factors, but nothing stands out. The stress which you say is certainly anecdotally, I have seen that a lot of patients who have been stressed and then they go on to develop cancer, but whether that is an observation, because I am only seeing patients with cancer and not seeing patients who are stressed but have not developed cancer, we do not know. But there is some theory that stress may suppress your immune system, and if there is an abnormality, it may cause any abnormalities to happen, such as cancer. I think it is largely unproven at this point in time, but a lot of patients do report that they have had a lot of stress in the preceding 6 to 12 months before the diagnosis.